All right, merci. All right, good afternoon. Just want to remind you and flag to you that tomorrow at 6:30 p.m. at the New School right here in New York in Greenwich Village, the Secretary General will deliver a major speech on gender equality entitled Women and Power. The speech will highlight areas where the power balance needs to shift, such as political representation, inclusive economies, the digital divide, climate, and conflict. If you'd like to attend and you have not yet RSVP'd, please see Florencia in my office. And the attendance is free. Turning to the COVID-19, in a joint statement, the World Health Organization and the World Tourism Organization said they are working in close consultation as well as with other partners to assist states to ensure that health measures to contain the spread of COVID-19 are implemented in ways that minimize unnecessary interference with international traffic and trade. The tourism sector is fully committed to putting people and their well-being first. The two agencies pointed out that the response needs to be proportionate to the public health threat based on local risk assessment and in line with WHO's overall guidance and recommendations. International cooperation will be key to ensure that the tourism sector effectively contributes to the containment of COVID-19. Turning to Syria, the situation in Idlib is increasingly dire following an increase in hostilities in the last 48 hours. That's according to the Office of the Coordination of Humanitarian Affairs. Airstrikes have been reported yesterday in 19 communities and shelling in 10 villages in Idlib and Hama. Civilians continue to bear the brunt of the hostilities. At least 21 civilians, including 5 women and 9 children, were reportedly killed by airstrikes and as well as ground-based attacks. The strikes also hit and damaged educational and medical facilities, including several that were serving as shelter for displaced people. Idlib Central Hospital was among the facilities reportedly damaged yesterday. The UN continues to seek ways to expand the ongoing humanitarian response on the ground, including by expanding the capacity of cross-border mechanism to accommodate up to 100 trucks per day. Needs on the ground, however, continue to outstrip the humanitarian community's capacity to respond. The most urgent need remains an immediate ceasefire and protection of civilians. Turning to Ethiopia, the government of Ethiopia, as well as the UN and our humanitarian partners, released the 2020 Humanitarian Response Plan, which seeks $1 billion to reach 7 million people with food and non-food assistance. Of these, 81% are women and children. Food insecurity, displacement as a result of conflict, disease outbreak, and climate-related factors, including drought and floods, remain key drivers of humanitarian needs in Ethiopia. And in Niger, the government, along with the UN and its partners, today jointly launched the Humanitarian Response Plan for this year, as well as the government support plan. The UN plan seeks $400 million, while the government plan seeks $320 million. The two plans, combined with the help of 2 million the two plans combined will help 2 million of the most vulnerable. Niger continues to face constant population displacement due to increased activities by non-state armed groups in the Tillaberi and Tawa regions in the west and the Nadifa region in the southeast, while food insecurity and malnutrition threaten millions of people across the country. And our humanitarian colleagues tell us that the border area of Mali, Burkina Faso, and Niger has become the epicenter of a fast-growing crisis with unprecedented levels of armed violence. According to the Office of the Coordination of Humanitarian Affairs, armed assailants are directly targeting schools and forcing health centers to close, depriving communities of critical services. More than 3,600 schools and 241 health centers are no longer operating in those countries. To support national and local authorities, we, along with our partners, are scaling up operations to save lives and alleviate human suffering and are appealing for $1 billion to support the most vulnerable. This month, $17 million has been allocated from the UN Central Emergency Response Fund for Burkina Faso and Mali to provide provisions of shelter, water, sanitation, protection, health, and food security. Halas, bitul.
Thank you, staff. 2 questions. First, on the coronavirus, what measures have been taken for the UN headquarters against the new coronavirus? And the second one is on Syria. Russia has been suggesting humanitarian corridors for the civilians to leave Idlib, but UN humanitarian chief Mark Lowcock said that there was nowhere safe in Idlib. Has the UN asked the Russians where these civilians could go? And how many babies and children, do you have an update on that, have frozen to death?
On your last part, I do know there have been victims. I don't have an exact number. We will try to get you one. We are in touch with all the parties on the ground to see where and when we can reach the people most in need of humanitarian aid. Obviously, we're doing, as we've been mentioning, some cross-border operations, and as we've said, we are in touch with the Syrian authorities to see how we can also move aid into those areas. What is important is that there is a cessation of hostilities. That will be the biggest positive move, immediate positive move that we could have in terms of getting aid in. In terms of the COVID-19, the coronavirus, the current risk assessment for the UN in New York is low. We are, of course, the situation is, of course, evolving. Risk assessment keeps getting updated. It's a dynamic process. We are in constant touch with the local health authorities in New York. We have well-established procedures with them on how to deal with any case that may come up, with any health emergencies. We have well-established protocols in terms of how we integrate our response here with the medical service with the host authorities. I would also add that the UN being hosted in New York, in the United States, which is a country with a very robust public health system in which we have full confidence.
I have a follow-up on Syria. Is Russia suggesting that the civilians go to the government-controlled areas or up to the north towards the Turkish border? These humanitarian corridors.
I can't get into the detail of the discussions. We are trying to reach people from whichever side, right? I mean, whatever is more. It's not an either or. So we're reaching people from Turkey through cross-border, and obviously also trying to move aid in through government-controlled areas. Maggie, and then we'll go to the back.
Staying on Idlib, you sort of rushed through it. Did you say the UN is trying to expand to the 100 trucks, or did you agree it with Turkey? Because yesterday you said something about trying to increase from 50 to 100.
We're trying to expand to 100.
So it's not been agreed yet.
No, let me re-look at what I read so I didn't... Yes, we're looking for ways to expand to up to 100 trucks.
Okay, so will you let us know then when that discussion
that number is reached.
concludes,
yes,
what comes out of it? Thank you.
Yes.
In regards to Ethiopia, is there any funding from the 2020 response plan going towards the low-cost crisis?
Well, we have put in a request. There was a joint request from FAO and WFP for response to the locust crisis. Obviously, part of the humanitarian response plan for Ethiopia will have to deal with the crisis, with the locust crisis. Yep.
Thanks, Steph. You mentioned the Secretary General talking before a bunch of students in New York about gender equality. Do you think the issue of Harvey Weinstein is going to come up? I wouldn't expect him to address the specifics of the case, but does he feel that the Weinstein conviction in some way represents a turning point?
Whether or not, it's not just a bunch of students. Obviously, we hope it'll be a bunch of you as well. And it'll be other invited guests. But obviously, it's very important to speak to students. Whether there'll be a Q&A with the audience, whether it comes up, I don't know. But it's clear, I think, to everyone that the conviction is an important turning point. And I think the Secretary General has always called for accountability of people who perpetrate violence against women. Yep, and then Edie, sorry.
Two questions. First is, are you able to give any more color on what the Syrian government has responded to you to the SG's office as you've been advocating for more ways to get aid in there anymore?
It's a constant. I mean, we have a large presence in Damascus. It's a constant dialogue. Obviously, we're dealing with an active conflict zone, which makes the delivery of aid extremely difficult, to say the least.
Thank you. And then the second question is, just ahead of today's meeting organized by Belgium on non-proliferation, can the SG weigh in a little bit on where things stand with non-proliferation and where, what kind of a priority this is for him at the moment?
The non-proliferation of
Security Council meeting.
Yeah, I mean, the issue of non-proliferation is one that the Secretary General, I think, has been very vocal about, and will continue to do so. Edie.
Steph, does the Secretary General have any further comment on the riots in India over the new citizenship law? And has he communicated at all to the Indian government?
I think he's very saddened by the reports of casualties following the protests in Delhi. And as he has done in similar circumstances, he calls for maximum restraint and for violence to be avoided. Amanda.
Thanks, Steph. So a couple of questions. There have been reports of a UN staffer in Vienna who may have been diagnosed with coronavirus. Do you have any information about that? Mm-hmm. And also on Libya, I know that Special Representative Salame will be briefing the Council later today behind closed doors, but there was the political meeting in Geneva earlier. Can you give us more details on who attended, how things went?
Short answer is yes, the meeting's taking place. Longer answer is I have no details to provide to you because I have none. But it's obviously good that the meeting's taking place. Vienna. Yes, there was earlier today. There was a suspected case. That person was transferred from the UN's medical service in Vienna to specialized health facilities in Vienna, and it was subsequently cleared of having COVID-19. So that person does not have the COVID-19. Alan, then we'll go back to you, Maggie.
Thank you, Stéphane. Yesterday it was a meeting of host country committee, again regarding the ongoing problems with the issuing of U.S. visas. And according to Russian side, Russian diplomats addressed to Secretary General asking him to launch the arbitration procedure. So did Secretary General really get such a request, and what will be the further steps?
Look, I think the issue of non-issuance of visas, of stringent travel restrictions on representatives of certain member states is an issue that's of great concern to the Secretary General, and I think he's expressed it himself directly here in the press conference not too long ago. Both the Secretary General and his legal counsel continue to raise those concerns with senior host country government officials and trying to seek a resolution to the issue. Maggie.
So just following up on the Vienna situation, has the UN thought about curtailing some travel then to hotspots?
We are following guidance by WHO, and obviously people should use the guidance is that only travel, essential travel to certain areas where the virus is present should be had. I would say that in the case of Vienna, the systems worked, and it's the same kinds of systems we have here, where our medical service here is well trained to respond immediately to anyone who shows any sign of possible symptoms, and then working very closely with the local health authorities.
So on that, I was just thinking about CSW, and I know you had said earlier when we asked about it that it's up to the national authorities, the host country, to screen travelers,
Right.
which is fine. But then let's say one of our delegates gets here and they show symptoms 4 days after arrival or 5 days after arrival. Is the UN medical service set up to deal with it?
Yes, so a couple of things. First of all, anybody who comes to participate in a conference will receive a package with up-to-date information on COVID-19, advice on prevention, on how to detect any symptoms, and treatment. The information will also be made available to anybody attending a conference. There'll be reminders at the start of each event for participants to seek medical assistance. And the UN medical staff here is trained and able to provide assistance and will treat, we'll deal with the issue very, very quickly. I've spoken a couple of times in the last few days with with Dr. Gillian Farmer, who's the head of the medical service, and I can tell you they are very much on top of that situation. Yes, sir.
Thanks again. There was a question before about the non-proliferation meeting this afternoon. I think there's a bit more to it, which is that this is part of the run-up to the NPT review conference in April. And this is going to be occurring against a backdrop of things like Russia and the US significantly increasing their spending on nuclear arsenals, and also at a time where diplomacy on North Korea and Iran is, let's face it, going badly. What are going to be the guiding UN messages from you guys to the NPT delegates over the next couple of months?
Is to come together and avoid any further backsliding that we have seen in the non-proliferation regime. Whether it was the ending of the Intermediate Range Nuclear Forces Treaty between the U.S. and Russia, and other areas in the world where we've frankly seen a backsliding. Yes, sir.
You mentioned before the increasing crisis in the border region of Niger, Mali, and Burkina Faso. Who made the request for the $1 billion? And can you remind me who is in charge at UN of that crisis?
Well, we have the request was made by our humanitarian colleagues. This was the $400 million UN plan and the $320 million plan requested by the government, and then there's a larger regional plan for appealing for $1 billion. Our colleagues in the humanitarian office are obviously overlooking those humanitarian efforts in close liaison not only with the government but with regional authorities. Yes, Maggie.
Don't close your binder just yet. One more on COVID. You said the other day you would get us some information on whether registration for CSW has been affected by the outbreak.
Yeah, it's a little early to tell. The registration in terms of people sending in applications has not been impacted. We've gotten the same. I talked to our security colleagues. They've gotten the same number of requests for passes as in previous years. What often happens is that you get X number of requests for passes, and then there's actually X minuses or numbers that actually pick them up. So, on that sense, we have no indication.
And will you have data on what countries people are coming from that you could share with us?
I will, but I think once we get closer to the date, because I said, it's kind of like press, right? No, it's kind of like press accreditations. Also for the GA, we get a huge amount of requests. Not everybody shows up, so we'll have to see who actually shows up. But I would stress that the situation is evolving every day and is fluid, and the risk assessments are done on a daily basis. But that the risk for New York remains low. Yes, ma'am.
I just want to come back to the question of visa in the host country committee. I was just wondering if you know if the number of visas that were not issued, let's say, over the last year, is it unprecedented? Is it higher than usual? Do you have an idea?
I hate to use the term unprecedented because I haven't been around for 75 years. The number is high, and I will leave it at that. Thank you.